And we are live. Happy Wealthy Wednesday, but today is a special event. I am so honored to be a part of this event, and this has been a long time coming. And you can see we have the whole gang here. I'm so overjoyed. I'm so excited. Today we're going to be talking about saving teen lives, and this is the long-term care edition. Saving teen lives. This is such a crucial and very critical, important conversation. Distracted driving is rampant. I'm sure as you driving through their day, you see people who are on their phones. Some of them are even watching TV. Some of them are even doing live streams. I mean, it's just gotten so incredibly like an epidemic that people are having so much distracted driving. And so we're going to be highlighting long-term care, what is long-term care, and how does this all go together? And to host us, we have the one, the only. He is a passion for saving teen lives. He's the creator of Saving Teen Lives. He's been on a book. He actually has his YouTube channel. He's got his merch now. He is passionate about this crusade. So please welcome the one and only Mr. Chris. We call him Brother Chris Monastery. Welcome, Brother Chris. Welcome, welcome. Can you hear us?
Yeah, I hear you, Miss Leah. I didn't get everything
Awesome.
what you were saying, but I was talking
Take it
with
away.
Martha on the text, with Margaret on the text. I didn't get to hear what you were saying, but anyway, welcome to Saving Teen Lives in our special event. And Margaret's going to introduce Martha into our new team. I'm going to let her go ahead and do that first, and then I'm going to pick up from where she left off, if that's okay.
Thank you so much, Brother Chris, and welcome everyone. And I just want to say a special note of gratitude to Brother Chris for making all this possible with Saving Teen Lives and having Leah Garcia, our Dynasty Builder, here and doing this stream. Thank you so much. And Cherry, my co-host, yay! Thank you for being here. I love seeing everyone, but I want to give out a warm welcome to our newest member here. And we're truly blessed and honored to welcome. She's just a remarkable person and just a new member to our team. Miss Marta Amaya Lobos joins us at Saving Teen Lives, not only as, her being a dedicated advocate, but she is someone whose work reflects compassion, service, deep commitment to helping everyone, and especially those who are experiencing homelessness and hardships. It's not just homelessness, but it's hardships also to her local community, and believe it or not, also globally. So her passion stands up for people in need and creating positive change. I mean, all of this is inspiring to us, and we're grateful to have someone with her heart, her experience, and her dedication joining Saving Teen Lives mission with Brother Chris. So please know that, Martha, we are absolutely thrilled to work alongside you and learn from you, support the meaningful impact that you continue to make. And on our behalf of the entire team, welcome. We're very happy you're here, and we look forward to all we will accomplish as a unity. So please join me in welcoming and giving Marta Amaya Lobos a huge warm welcome. Thank you so much. Brother Chris, over to you.
Oh, thank you, Margaret, for doing that for me. Yeah, and I wanted to just say, thanks. And Martha, thank you for accepting me to ask you to come and join Saving Teen Lives. Through my ordeal, Miss Leah and Sherry and Margaret, when I first come home from the hospital, Martha really stepped up to the plate and really was advocating for me with my Humana insurance. We had an ordeal, but we're not going to get into it because tonight is a special night and on long-term care and for Miss welcome Miss Leah Garcia as a Dynasty Builder and Financial Strategy, the Wall of Wealth. And Margaret Martinez, a proud mom and relation coaching, helping families get connected with teams and communications, and a public speaker and a global financial on Go Brunch partnership, Unforgettable LLC, and Miss Sherry Holmes, kindergarten teacher, education, and Martha, service with a purpose, connect, impact hub. Okay, and take it away, Miss Leah, from where you need to start.
Yeah, great introductions. And this truly is a collaboration. And that's what I love about social media is having an opportunity to showcase others in their communities who are doing incredible things. And every single one of our speakers today does incredible things. They've got a heart to help people and they do it all in some form or fashion. And today we're talking about saving teen lives, but long-term care. And you know what? Many families don't lose their wealth because of a bad investment. Many families lose their wealth because of an unexpected health event. I'm going to say that again. Oftentimes people think, oh, it was a stock market crash, my house got foreclosed on, or I lost that job. But most financial devastation, even to this day in 2026, as we're recording this, and this has been true for many years. I've been in this industry now 20 years, and I've been saying this for 20 years. The number one cause of financial devastation is due to a medical occurrence. Even with the Affordable Care Act, you know, that passed in 2014, and they told us that was going to resolve that. There wouldn't be people who would be losing their homes and losing their finances because of health concerns. And with all due respect, I know it helps a lot of people, but there's still financial devastation due to medical expenses. And that's what we're talking about here today. That's the conversation we're going to have. And I'm going to kick this off with a story, a personal story. My nephew, when he was 19, this was 4 years ago, almost 4 years ago today, actually. It was April 15th, 4 years ago. He was driving his motorcycle, and 19-year-olds, you know, they love motorcycles, love to drive fast. He was on a highway, type of like a freeway type in Texas, and he was actually hit by a truck and didn't see him, never slowed down, was no fault of his own. He wasn't doing anything wrong. And the impact was so dramatic that it ejected him 90 feet off of the motorcycle. 19 years old. Can you imagine? My niece called me. He's actually my great nephew. My niece called me. It was like 11:30 at night here in California. And she's like, please pray. Chris was just in an accident, and we don't know if he's going to make it through the night. He was just airlifted. And literally, in fact, he had another surgery today. She was in the hospital with him. He was in a coma for 4 months. We didn't know what would happen. He had a traumatic brain injury. We didn't know if he would survive. We didn't know what would happen. And you know, even till today, I mean, he's got a traumatic brain injury. He's still working to get full use of his body. The surgery he had today was so that he could get use of his thumb. And so here's the thing. At 19 years old, you may think, oh, well, you're never going to need long-term care. When we hear that term long-term care, people think it's about somebody who's well into their golden years. They're on the other side of, you know, on the other side of things and in retirement, and they're in their their no-go years, right? There's the go-go years, the slow-go years, and the no-go years. We think, oh, that's not going to happen until I'm old and gray and many, many years from now. But you know what? An accident or illness knows no age. We never expected that. And my niece has thousands and thousands of dollars in medical bills. because of this. Now, thank God he lived. We're so grateful. We're so, so grateful. But it is a financial impact to the family. And those are medical bills that she'll be paying for many, many years. So what is the options that we have? What are the things that we could do? So I want to hear from our panelists. I want to hear, because I know all of them have incredible stories, and I want to kick it off with Chris. Go ahead, Brother Chris, and share with us some of your story.
Oh, thanks, Miss Leah. Uh, you know, people don't realize the depth of long-term care. And I know I was 18 when I had my accident, and long-term care was expensive for us. Didn't have no things set aside. If it had not been for the Medicaid insurance I had, my mom and dad would have been in so deep a debt to try to rent stuff to get me to lift me from the bed to the wheelchair or to the bathroom into the tub and stuff. And it was very hard because it was expensive to rent day by day to rent a lift. And then not only that, I did have a trach when I came home, and they had to rent a machine for that too. And you know, it was just really hard for mom and them to try to rent this stuff, and that's why we put this together so we can get parents aware and teens to be aware long-term care, what a spinal cord injury can do to you, because some people don't recover from spinal cord injury. They need long-term care. They need a nurse to come, or parents to take care of them for the rest of their life, because spinal cord injury, sometimes you're from the shoulders all the way down, never get used to your hands or your legs, and then you got to have some kind of lift to lift your child from the bed to the wheelchair, from the wheelchair to the tub. Then you got to have that lift to lift them into the car to take them to the doctor and stuff. That's a permanent injury, spinal cord injury. And I want to just say, I was thank God that in my long-term care of being this coming home from 8 months of being in a hospital, not knowing that I was going to be able to walk again or be able to use my arm, because I was supposed to be a total quadriplegic. And thank God that God gave me the ability to get my movement. And I'd be married 31 years and didn't have to stay in long-term care because I got my movement back. But some children, teens don't get that back, and they having to depend on mom and dad to do it all. And if you ain't got nothing set aside, what happens to your child when mom and dad can't do it anymore? So that's a lot to think about, because in 30 days I was back up and walking. I walked to college, even though I still had to use my wheelchair to go to college because of the dome being so big. But I was walking inside the dome, but going to classrooms, I had to use my chair. But, you know, we need to think about what's going to happen, because when you get a spinal cord injury, it takes an effect on your body as your child gets older. And I'm going through it right now. So, what you got to add, Miss Leah, Martha, or Margaret and Sherry? Y'all, it's up.
Absolutely.
Give me something.
Yeah, definitely. Thank you for sharing that story, Chris. And every time I hear it, it just hits me so deeply, because I know it's not only you, it happened to you, but many, many people suffer those types of injuries. And I'm going to hand it over to Miss Margaret Martinez. She's going to do our formal introductions and our greetings to the people who have joined us in the audience. Thank you for joining us. Go ahead, Miss Margaret.
Thank you so much, Leah. And yes, that was very touching. Story, Brother Chris. You have such a powerful story. And from that, this stemmed, right? This is where we just, blossom from this. I want to welcome in Leslie Flowers. She says, hi, everyone. How did I not know about this? Trust all is well in your worlds. Thank you so much. And Wax, hello to everyone. Thank you so much for being here. And Robert Berry, thank you. And everyone who's watching and not commenting, we appreciate you just looking at this. So thank you so much for watching, and join in if you'd like. And I'm going to hand it over to Marta, and then I will talk about how teens can be involved in this too. Over to you, Marta. Thank you.
Oh, thank you so much, Margaret. I want to thank Brother Chris for inviting me to be part of Saving Teen Lives. I'm really stoked to be here. Also, Leah for hosting today. Margaret, Sherry, thank you both, all three of you guys, for just being part of this and having this important conversation on long-term care. As far as what I do at Connect Impact Up, we provide advocacy services to unhoused, but we're also servicing now low-income families. Whether it's a person or families, we're out there supporting on an advocacy level, and sometimes they involve healthcare. And what I've been coming across is we are not taught in school about long-term benefits, what we need to have planned for the future, and it's not really promoted enough in the workplace. And so having this conversation out loud, being able to be here with Leah, who is a financial strategist, that can give us that more information in depth to learn from her. I think this is phenomenal. As far as also long-term care is, yes, me and Brother Chris, we've been going back and forth for several months, and having these conversations out loud can be also emotional. It's a lot to talk about for something that you don't really know about, or who to trust to speak about this type of situations that may come up, either financially, long-term, short-term. So just wanted to jump in to share a little bit about that. And then as we continue to converse, I'll jump in. I'll pass it back over to you, Margaret. Thank you.
Thank you so much. It's powerful how this actually hits every single one of us, right? And because we don't think of things of, long-term care, especially when we're young. And Marta brought up a lot of good points, where she serves, how she comes up for the community and how it affects them. Because I'm sure, like Leah, you see a lot of this too. But with teenagers, you don't think of that because, when we're teens, we feel like that's never going to happen. We're invincible. What do you mean getting older? But it's true, and it comes a lot. I think everyone can agree that it comes a lot faster than we plan, right? So how can our teens prep? Everyone knows I have a teenager. So, it's very important to start even prepping for that right now. Welcome in, Paul Clayton. Thank you. And how they can do that is they can actually get involved with people like Leah and Marta and Brother Chris to visit and see what they can do with the community and learn those things, right? And what I mean by that is you can speak to family members, you can speak to your local senior homes, the community, they have assisted living, they have senior community, they have different even rehabilitation centers that they have permanent residency there also. And you can get involved in their volunteer work, learn CPR. There's healthy habits that you can learn, and you can encourage teenagers, whether it's your own teenager, your granddaughters, your nephews, whoever it is, and start getting involved of what can we do? How can we learn? As we've heard from Leah being a Dynasty Builder. She's a financial strategist. She can also, if your team speaks to somebody like her, they can learn the basic financial strategies of how to build for long-term care, right? Everyone knows it's not just savings, but you can also start building up and start funding, and create, Roth. You can do all of these things, but you can learn even if you have to wait till you're 18. Right now is the time to learn all of these things, right? There's also technology. Teenagers are so savvy and so quick with technology. Technology now levels you up and gives you that boost to learn how to financial strategize yourself. What kind of questions do we have about our seniors, about the community, long-term care people? You can assist them. What can you do? There is nothing that you cannot find on the internet when you just ask them, how can I show up for long-term care? What can I do to learn this? How can I get involved? And then there's also healthy habits that you can learn as well, and you can implement. And not only that, but when you're a teenager and you show up for someone who's in long-term care, you're actually an inspiration. You become the reason why they want to succeed. They want to help you, and they become more of confident, because you're inspiring one another. So it's team building. It's like right here, what we're doing right now. It's team building, one for another. We're showing up for each other, and it's also about consistency. And I believe that teenagers, with the encouragement of guardians, parents, whoever, they will show up in ways that just are astounding. And so I want to thank you. Thank you for letting me speak about teenagers and how they actually fit into long-term care. And so I'll hand it over to you. Thank you so much, Leah.
Absolutely. Great points. And we want to welcome the great, amazing Miss Jackie Hallberg. She actually hosts Just Jacks and Friends on Mondays. I love to see you. I love her voice. I want her to read me bedtime stories. And I want to start this off with understanding what long-term care is. How does health insurance fit into this? And there's so much confusion about this. Whenever you have a medical event that lasts more than 90 days and you have, or someone you care about needs assistance, what they call with the activities of daily living, there are 6 of them. Bathing means showering or bathing yourself, dressing, putting your own clothes on, eating. Can you feed yourself? I've had actually several clients that have broken both of their wrists. And so in those kind of situations, you cannot feed yourself. Toileting. Can you take yourself to the toilet? Okay. It is what it is. Transferring, meaning transferring yourself from the bed to a chair or out of bed. Can you transfer incontinence? Okay. Meaning that you cannot, you need to have a catheter or something like that. So if you need help with 2 out of the 6 daily livings for more than 90 days, your health insurance is now going to assume that this is a long-term care event, and they're going to start resisting payment on those services. Many of you may have heard about these kinds of things. Well, they had health insurance. Well, health insurance will take care of you until that 90 day. When it goes longer than that, they consider a long-term care event. And now they're going to say this falls out of our jurisdiction. And now you've got to find other resources to address the long-term care. Does anybody have anything they'd like to add right now? I haven't heard from Miss Martha. What do you have to share about this?
Yeah, thanks, Leah, for bringing this up. Regarding insurances, I have learned that, for example, Medicaid's coverage is different in each state. And like here in California, once a person, for example, goes into, they send them to a rehab and then to a nursing program so they can have more time, you know, they obviously have to submit an authorization request. So there are workarounds that can happen on a billing level. So it would have to start obviously with the provider to authorize it, and then from there the diagnosis, because they want to see improvement. If they see improvement with the patient, then they're going to get discharged. I come across this. I had a case of a gentleman who was unhoused. This was last year. He was in a wheelchair. And I'm going to share this example because I think it's significant. And he had nowhere to go, and the hospital wanted to discharge him to rehab. Insurance was going to cover rehab, but what happened was no rehab center in this county would accept him. And so we started looking outside the county. Eventually, he just got tired of being in the hospital and just ended up leaving the hospital and not getting any more services because he got tired of waiting. So that's another scenario, but the waiting period for him was no one would accept him. They were either at full capacity or they just didn't want to take him in. And that's another thing we really got to talk about more is why, if we are not accepting these patients into our facilities for whatever reasons, we should have some backup locations that the hospital should provide temporarily while we get people situated, because they can't stay in the hospital for rehab services or nursing care. I kind of went off subject, Leah, but I'll pass it back to you.
No, it's not off subject. It really isn't. The line is very, very blurred when it comes to long-term care. And yes, if somebody is unhoused or they're in a situation where there's nobody there at home for them, maybe they do have a place to reside. However, they need more care in between those support when they're going in and getting their rehabilitation, and they don't have those resources. It is a huge gap in our society, in our health insurance. And that's why this conversation, there are many, many, pitfalls or just those blind spots that we're not aware of until we actually use our benefits. And just like you alluded to, Medicaid in California, we call it Medi-Cal. There's many gaps. Just because you have a card, don't assume that they're going to pay. Don't assume that you'll get access. Don't assume that you just swipe your card and now suddenly you're going to be able to get access to the benefits and to the rehab that you're assuming that you should have access to and that your body requires. So great points. And I want to hear from Brother Chris, because you're really, I'm sorry, go ahead, Ms. Martha.
So I just want to add one last thing. We are in a crisis right now here in the States when it comes to healthcare. We're already dealing with systems that are broken. We don't have enough providers. We don't have enough facilities. I mean, there's data that I'm learning as we speak that we are already in a crisis, and this crisis is only going to get worse by 2030 due to our baby boomers getting of age that are going to need more support. All right, I'll pass it back over. Thanks.
You are so on point. This is one of my favorite conversations because it really doesn't get enough highlight. It doesn't get enough engagement. People, it's like something they just don't want to talk about, but it's so necessary. Your points are well taken. Chris, share a little bit about why you got into this, because we know your story, but what made you make a decision that you wanted to really talk about teen lives and saving teen lives?
You see, Leah, this is a good example. That's why I wanted to bring this long-term care into effect, because I was a teenager when I became disabled. And let me just say, it's been really stressful with this insurance if it had not been for Martha advocating for me, because I have been through a lot, because I had to have this surgery done. And that was the reason I wanted y'all to come and share about what insurance can do. I have learned a lot in the, I guess, in the last 3 months of February, about 3 months now, 2 months for sure. Me and Martha went round and round, and it's just everything with the insurance and long-term care. The doctors have to make a point that if they don't say that it's medically necessary, this is what happens. They deny you to go to any type of rehab. They deny you home health because it's not medically necessary. If the doctor don't say it's medically necessary, you will get denied because I had the surgery. They put a rod in my tibia bone in my ankle, and when they said that I was, now this is the insurance. Now the insurance got their own doctors. They never even come out and evaluate. They made their decision because I had the rod in my leg, and that I wasn't able to put pressure. I was weight bound for 6 to 8 weeks. I could not put weight on my leg. But the insurance made a decision when it went over to them, since physical therapy came and stood me up and moved me to sit out in the chair. I was able to put pressure on my leg and walk with my ankle. That was not true at all. I couldn't even put no pressure. They was holding my left leg so that the leg didn't put no pressure to do no damage until I was able to be released after 6 to 8 weeks to put pressure. And the insurance kept denying because it wasn't medically necessary. So I couldn't get the 2 weeks of rehab that I needed, because the insurance doctors don't go out in their field and go and evaluate patients. That's the problem with our insurance, is they have their own in-house doctors that makes decisions. They read notes. And the doctor that did the surgery tried to send over all the data report, all the x-rays, tried to send notes over to them that everything that I needed was medically necessary, and it was refused by the insurance. Body insurance. This is what you, parents, etc., grandparents, aunt, uncle, this is what you got to realize. This is real. This happens. Because I know when I stood in the hospital, 8 months I stood in, and 6 months of being into the hospital, 6 months being into the hospital, my insurance from the job that I had quit paying out. They ran out. There was no more funds for them to pay the hospital bill. No more. And if it had not been that Medicaid kicked in, I still would be having a hospital bill to pay right now, because because your work insurance ran out. There wasn't no more. Take it away, Miss Leah.
Yeah, thank you for sharing that story. And it's so true. Health insurance, remember that it's always going to have gaps. Whatever type of health insurance you have, whether it is Medicare, Medicaid, or it is even a PPO, if you have insurance through work, if you have private insurance, no matter what type of insurance you have, there's going to be things that they pay for and things that they don't pay for. And so for all of my clients, every one of my clients that I help them with to get access to health insurance, I always pair it up with living benefits. And living benefits, there's a lot of different types of living benefits, but essentially these are programs that will pay if you were to have a major accident, right? And you had an extended period, 90 days, that you were not able to feed yourself, dress yourself. Things that will pay for you, that will pay percentage If you were diagnosed with cancer, heart attack, stroke, Lou Gehrig's, Alzheimer's, even paralysis, right? Where you've got paralysis on 2 or more limbs, blindness. If you were to have any one of these types of situations, even an accident plan. So though all of these living benefits, although they may not be exactly qualified as long-term care, they are living benefits that will pay you so that you can eclipse those out of pockets, those deductibles, co-pays, limitations and exclusions, things that insurance doesn't pay for. Don't assume that your health insurance, just because it got authorized, that the insurance will pay for it. Remember, pre-authorization is required in many times, and it is not a guarantee of payment. It says it right there. It's not a guarantee of payment. And so the younger you can get long-term care or living benefits, the more affordable it is. And one of my favorite ways to do that is life insurance with living benefits. If you're young, healthy, 18, 25 years old, it's minimal, $10, $15 a month. And think about that. You're set up for the rest of your life if something were to happen, because it's like 75% or 85% of us will have some form of a long-term care episode in our lifetime. So, Ms. Margaret, we have a few more people who've joined us. I want you to welcome in, and I want you to add your thoughts too.
Thank you so much, Leah. I appreciate you. Yes, let's welcome in some more people. I hope I can see them. Actually, I can't. I cannot see any. I can just see Leslie and Robert still.
Okay.
I'm not sure why I can't see anybody, and I'm actually using my phone to look, because I kind of do that when I do my streaming as well as just backup. But for some reason, I can only see those 3 lovely people. I can't even see Jackie on here.
Okay. That's okay. Give us your thoughts.
Okay. This is such a great conversation. And after hearing Brother Chris's story, I am thinking of, as being an emotional wellness, having that awareness. And I'm thinking of Brother Chris and many other people out there. And I'm thinking of their mental health care, right? What this does to someone when they have to go through something like this, the trauma, how it affects their mental health, how, the stress and the worry of inflation, right? Like, will the policy include that protection for them? What does this look like in 5 to 10, 20 years, And what can we do about it? Another thing that Martha had put that was very important was about the healthcare and the crisis that's happening, right? What can we do? How can we strengthen all of this so that it doesn't affect us? Prevention is one thing, and prevention on whether it's an illness, an autoimmune disease, things like that. And I'm also thinking about our veterans, because, and I'm in thought of that because my father was retired military and in the Air Force. And I'm thinking of veterans who are out there, and especially during this Memorial time, and, and every day, because I see them out, out and holding signs that say, help me, I'm a disabled veteran, So I'm thinking about that too. How do we show up for them, especially, with how can we prove that mental health care for them? And how can we simplify the insurance, especially in our U.S. systems? It just seems like they make it so complex, but how can we simplify it so that we can just stop the chaos of confusion of either bills or policies and stuff? And how can we even lower prescription costs. You know, there's so many things to expand and talk about. But on the forefront, especially after hearing Brother Chris's stories, my heart always goes to the emotional well-being and the quality of life of one's mental health as well as physical. But how, you know, because the mind and the body, they're one. It's one. There's no division there. So the spirit, the mind, the body, you know, everything is effective. So one of the things I was going to ask you, Leah, is how you felt about that inflation. You know, does that affect policies? Thank you so much.
What was the question again? I'm sorry, Miss Margaret. How do I feel about?
Oh, I was asking you, yes, if you can expand on that, like when somebody asks you, how is it, you know, the inflation going to affect my policy, you know, and will it rise? What does that look like in 5-20 years or whatever? And does it affect the policy? Thank you.
Yeah, great question. And everybody's really kind of alluded to this. Really, with our system, and I don't know any other system, I've only lived in the US, but in our system, there is a disconnect between Medicare, Medicaid, veterans benefit, drug prescriptions. Like all of these systems are all trying to work in their own silo. And really, to make comprehensive care, we have to lower those boundaries and take down those walls and really just look at it holistically and proactively. You're a human, you need care. What can we do? How do we get you those benefits? And yes, with inflation, I've seen people who are, I mean, I help people, it seems like almost every single week there are people coming to me who are going to cancel their health insurance and they're looking for options. And just even the other day, their health insurance for their family of 3, by the way, family of 3, 2 adults in their early 60s, and they have a teenage son, 15 years old, and the premium for their health insurance, their monthly premium was going to be $4,200 a month. Can you imagine that? $4,200 a month. They said, we cannot do this. So I helped them with a medical cost sharing plan, which is an alternative to health insurance. Their benefits now are about $1,200 a month. So we're talking about significant dollars, but most people don't know about these options. And when it comes to our veterans, they really get kicked by the wayside. I mean, there's so many people, it's almost like if you don't have money, you don't have a voice. You know, it's a people who can write the check are the ones that make the rules. And we got to be better than that. We got to speak up for our veterans. We got to speak up for our seniors who are on Medicare. We got to speak up for our people who are low income and Medicaid. And healthcare should be a human right to get access to. And sometimes I just don't even understand it. That's why I don't sell health insurance anymore. I don't sell traditional health insurance, because I know all the gaps. So I hope that answered your question, but really, really important information. Miss Martha, you've been a little quiet here. I know that you've got a lot. I hear your thoughts. I know you've got
I've been holding on. Yeah, you can feel my energy. You know, as I'm listening to you, I think about, I had a veteran recently out of Kansas who they have no insurance. And their crisis is so big that it's now affecting their mental health. And they couldn't even hold a conversation over the phone with me, you know? So there's a crisis in a crisis. And the solution is within the healthcare systems, okay? Each insurance company, a lot of people don't know this, there are care managers. So there's this, it's called continuity of care, social determinants of health. It's all under the same umbrella. Basically, is insurances are now targeting low-income folks in a positive way to support their healthcare needs. So if you don't have an advocate, if you don't know how to maneuver your insurance, they're not covering something, you have questions, request to speak with a care manager, a case manager, a social worker. They have different names in each of the organizations. So depending on which health plan you're with, your verbiage, say, I need an advocate. I need someone to help me understand this because I don't understand it. It's important for us, the consumers, to ask questions. And if we can't ask the questions, step away, write them down, and regroup yourself. And when you're ready, make that call. Because a lot of times what I see is people cannot process the information. They have it in their mind. They know what they want to say. But when they're on the call, they tend to forget everything that they were going to ask. And so I always say, just write it down. We always write notes. Anytime I'm advocating for anybody, we're writing notes, and they're part of those notes. So whatever notes I took, I share those notes so that they have them for their records, so that there's nothing lost in transaction, if that makes sense.
Yeah, phenomenal point. You are right on. And not only do they, that we might get a little distracted, but it's very overwhelming. If you're not feeling well, you're in pain, you're having a current medical situation, it is very difficult to communicate, very difficult to express what is happening and what you need to get access to. And, I've been in the industry a long time, so I know the nomenclature of the business. I could have a conversation, which I do with many doctors, and they think sometimes, wow, are you a doctor? No, it's because I've been around the terminology and I understand the insurance terminology. But the average person does not understand that. They don't know what they mean by a copay or deductible or maximum out of pocket and all these different things. So point well taken. And we just have Miss Cherryberry who's entered the room. Great to see you here. We want to hear from you, Miss Cherryberry. I know I'm putting you on the little spot a little bit, but just tell people who you are and why you're here. We want to hear from you.
Leah, can I share one more thing? That's
yes,
okay?
Please do.
Okay.
Yes.
So I wanted to also mention that if a patient is ever admitted into the hospital for any services, they can request to speak with the case manager. And I would recommend this to anybody that visits a hospital, to ask either for an advocate or a case manager for support. Just wanted to share that because it could be overwhelming just being in a hospital and all these questions are coming your way and you need to make a decision, just to have someone there supporting you.
That's a great point. That's really a really great, profound point. Even if you have family there, again, when you're in a medical crisis, it's overwhelming. There's a lot going on. Paperwork's being put in your face and you're asked to make decisions. Do you want this? Do you want that? And all these different conversations that maybe you haven't had with your family. Do you want a DNR? Like, are you willing to take blood transfusions? Are there certain medications? Are you allergic to things? So absolutely ask for an advocate. Very profound, great thing. And also remember that there are a lot of, I'm sorry, go ahead.
I was going to mention power of attorney, advance directive. Also, for example, like if you have a child who, God forbid, gets in an accident, or, I don't know, I'm just kind of sharing a few examples, or myself, I'm in an accident, having someone as an emergency contact, but also having someone that is going to be capable of making decisions if I'm not able to speak for myself, how important that is in the planning of long-term care.
Absolutely. And we call that a living will. So a lot of people think that, planning can get kind of complicated, but Your will is basically your requests, and it includes your power of attorney and your medical directives, meaning, and your HIPAA release. So meaning, who do you want to have access to your medical information, your medical directives, or your medical power of attorney? Who can make medical decisions for you if you cannot make those decisions for yourself, and your financial power of attorney. And by the way, those you can really do really low cost, if not for free. Always get them notarized. Always get them notarized. It's not enough just to fill out the paperwork. Get a notary. I think if you go to like Staples or something like that, they'll have a notary there. But you got to have those legal documents. So great points. And I think Miss Cherryberry is still in the audience. Chris, we haven't heard from you in a little while. Do you have some thoughts you'd like to share with us?
Oh, yes, Sherry just called me. She's having trouble when she unmics. It kicks her out. I was told her to call me back. I'll try to see if I can get her to go through the phone and let her share whatever she's got. But, going back to what y'all saying, Miss Leah and Martha brought up a good idea. When you do go to the hospital and you do ask for an advocate or a care manager in the hospital, yeah, and I've been through this, and I just experienced this when I was in there. And you need to make sure your medical records, when you're admitted in or you get ready to get discharged, are up to par and right, because I had to do some corrections, and I still got to do some corrections. So you might, if you're going into the hospital and they reading off your records, and I went through this. They had me down as I was born with cerebral palsy, and I had to get them to correct that. And then I just now recently found out that they got me down as a smoker. So now I got to go back to the hospital and make them correct my records. This is what they do. These doctors, they got in-house doctors, and they assume they don't ask questions, the right questions. And when you give them the answers, I think that's wrong, and that needs to be corrected. They need to stop adding to what is not supposed to be there. And it's hard. And when you're in there and you got doctors come in, because I've been through it when I went through the surgery, and Martha helped me go through this when we called North Oaks. We had to I filed an agreement when I was in there, because they were saying my leg was rejecting the rod, and the surgery doctor came in, and I told him what was going on. Make a long story short, we filed an agreement. Now we're waiting on a decision from the board, what they're going to do about the wrong diagnosis that the in-house medical doctor gave me. So as a family member, you got a team, or even if it's one of your family members, you want to stay on top of when you're in there and making sure that when your insurance is paid for. I had to make some corrections too, because they had my insurance paying me for spinal cord check that wasn't even related to my leg. They had me having tests on my bladder that wasn't even done when I was in the hospital. These are things y'all might, parents and teens adults want to check as you get admitted into the hospital, and you have to stay, Miss Leah.
Absolutely. Great point. So these would be my 3 golden nuggets for all of you or anyone listening now or in the future. Is number 1, always get a PPO insurance as opposed to an HMO. I know the HMOs, they give you all these extra things and they're low cost. And if that's the only thing that's in your wheelhouse, your financially that you can have available to you, then, it is what it is. But if at all possible, always get a PPO, whether you are on the Covered California or the Affordable Care Act, whether you're going in through work and getting your insurance that way, whether you're getting it outside of your employer, maybe you're going direct to the employer. If you're on Medicare, always ask for a PPO. Number 2, always, and you touched on this, Chris, look at your medical records. Don't just assume that your doctor there is there writing down the right things. I mean, ask them what's in your medical records. What are they writing down? Because that is very prevalent. Maybe it's a misdiagnosis, maybe it's a misunderstanding, maybe they're assuming, I don't know, but those are your medical records, and those can really impact you in the future. Maybe they didn't write down that you were allergic to something or that you had certain beliefs, and you want to make sure that's what's in your medical records is truly your medical record. And number 3, please get some type of living benefits, whether you get it through your life insurance with living benefits, which is my favorite way. You can get living benefits through annuities. You can get living benefits on supplemental. So there's a lot of different ways to get living benefits to help you to offset those costs of things that are not paid for by traditional health insurance. So we're kind of winding down here. I want to go around the horn and get some final thoughts. I'll start it off with you, Miss Margaret.
Thank you so much. Oh my goodness, a lot of golden nuggets here and diamonds shooting out of everyone. Thank you so much for sharing. And thank you for streaming this, Leah. We wanted to give a greater visibility to saving teen lives. So we appreciate you doing that. And Martha, I love the way you and Chris were talking about medical records, because medical records are really important. I think what we can do is share with our teams to learn how to document, how to keep medical records now. I have a really good friend who is on disability, and she has her medical records from when she was a kid. So I thought that was amazing. And so I encourage for everyone, to inspire the younger generation to and kind of fill that gap, with that, actually, to encourage the power of documentation, and also, so that they can have that, because I feel like that is really important. And like Martha was talking about, another thing with like pre-authorization, you don't know any of those things. I will tell you this, being in medical field, when I used to have to do pre-auths, when you have a good doctor, they will fight for you. They're the ones who are going to battle the insurance, whether it's your retinal doctor or your other doctors, their nurses, they're the ones, the technicians are the ones who are getting this for you. You just have to, like, Martha said, you have to speak up. You have to tell them, hey, this is what I need. Because if you don't speak up and you don't say that, they will never be able to fight for you. So the important thing here is to speak and make your case known, because there's a lot of people really who are waiting to advocate for you, to help you, especially when it's an emergency situation, and they do have people that will help you, but you have to speak up and you have to say, this is what I need. These are my needs. And why would you do that? Because you're worth it, right? Your life is worth it. Your quality of living, your mental health, the person the human that you are, and the amazing person that you are, is worth other people showing up for you. All you have to do is just give them that chance, and they will. Thank you so much.
Absolutely. That's what it's about, us building this community. I'm so excited to be back here, like doing an old-fashioned LinkedIn audio room. I just love it. And Miss Cherryberry, she worked really hard to get here, wasn't able to be here, but we did see her presence, and her presence was definitely felt. And Miss Martha, what do you have to share with us with your closing thoughts?
Yeah, thank you so much, Leah. Oh, I see Sherry's here, and she's unmiked. Hey, Sherry, can you hear us? Man.
I can hear you.
Yay! I'm passing it over to you.
Oh, oh my goodness. I believe, Miss Leah, that what I wanted to share for long-term care, briefly, is that I've experienced. My mother has dementia, and she's in latter stages of dementia, and she's only 75, and she's had it since the beginning of the pandemic in 2020. So I guess what I had hoped to narrate to everyone is that we do need a plan, because when it came time to decide, put her in a memory care home, of her home health care, all of the options were not covered by health insurance. The only thing is if she had an injury, for example, when she fell, or if she had illness, infection. Yeah. So I think it's very important to get together with someone like Leah and collaborate, because as they say, don't make life decisions when you're during a marriage, a death, a divorce, having babies. I would say having to take care of your parent, because I took care of her until I couldn't. And thank you.
Yeah, a really good point. And that's something we could really have a deep dive into, is how do we take care of our seniors? I know a lot of people tell me, oh, my family's going to take care of me. I've got daughters, I've got sons, or I've got grandchildren. But really, I would ask you this, is that truly the last interactions that you want to have with your family, is them taking care of you? It rarely ends well. And I'm going to leave it there, because that's a whole nother conversation. But really, when it comes to taking care of our seniors, whether it's our parents or grandparents or aunties or uncles or friends, it's a very difficult undertaking. It is very taxing on your body. And I see many who are in that health, in that caretaker role, who actually succumb to their health, ends up being greatly compromised. So, but I want to wind this down. But oh my goodness, that was gold, Cherry Berry. I knew you'd bring the gold. And Chris, we want to hear some closing thoughts from you, my friend. I'm sorry, Miss Margaret, go ahead.
Oh, no, thank you so much. I wanted to chime in what Terry had said. And welcome, sis. I'm sorry to hear about your mom. My heart does go out to you. My dad had dementia. So, yeah, I know my heart is with you. I didn't want to dismiss that. But I was going to say, as far as with college, and Warren Buffett is one of the people that I listen to, and he actually advises us to set up for our long-term care, and this is one of the things that I do advise my daughter to set up, is for her long-term care, and start investing in herself. And another thing that he advises is actually not to pay for your child's college, but to pay to keep rolling in that money and investing into your long-term care. One of the things is he really stresses is that your child will learn how to save and invest on themselves by paying for their college, by doing all of these things. And the reason that I remember this is because of the wording of, oh, they'll take care of me, or this and that. Because one of the things that Warren Buffett says is, don't count on that. More than likely, they might not take care of you. And then what's going to happen to you? So one of the things that I did, my takeaway from that was to invest in yourself, in your long-term care. That's what I was going to add. Thank you so much.
Absolutely. I love Warren Buffett. He says the first rule of money is never lose money. The second rule is always remember rule 1. I love it. I love it. I love it. And as we close this out, thank you, Joshua Lee, for joining us. And I see a couple other people who are here. We appreciate you so much. If you joined us live, we appreciate you, Team Replay. And if you think this is an important topic, put your comments in the comments. Let us know what you think about this, your thoughts about it, what you'd like to add, and reshare this too. So I'm going to have Chris, our host. It's really the mastermind behind Saving Teen Lives and really bringing awareness to long-term care and what it has to do with our teens. So I'm going to let you close it out for us, Chris.
Oh, Miss Leah, this was Saving Teen Lives is we have to come together as parents and start putting children first. And first, most of all, is just before we close out, I got a question I wanted to find out from you is how long does it take when you start your long-term care if you get a policy? What is the grace period before it takes effect? And when does it start to pay out, and when does it stop paying out on long-term care? And I know we're coming to an end, but I was going to ask you this, and it slipped my mind. But as teenagers, we don't know the danger of what distraction driving is, and this is what I've been trying to get parents to sit down and talk to your teens about the danger of distraction driving. Because when you get distracted and you're looking off, it's 5 seconds you're driving with your eyes closed, the length of a football field, and an accident happens and your child is either permanent injured or they get deceased at the scene because they were being distracted either on the phone, number one thing, fooling with a radio, or they're not paying attention because they're listening to all the conversations that's going on the car. So, as we wind down, if you could just share a little bit about what I asked you, Miss Leah.
Yeah, great question. And I'm going to try to really keep it high level. So basically, long-term care, once you're approved and qualified, if you were to get approved today and you had an event that evening, there would be a 90-day elimination period. Think of it like your deductible. That means that you will not have coverage on traditional long-term care. You will not have coverage for the first 90 days. So that is like if you got into a car accident, you'd have to have a deductible. You'd have some share of costs. Well, your deductible on long-term care is a 90-day elimination period. After the 90 days, if your doctor signs and says you need assistance with 2 of those activities of daily living, then those long-term care benefits will kick in. What I prefer, I like long-term care. It's great, traditional long-term care. Again, I like it as a rider on life insurance. You can have a long-term care rider on even term life insurance. However, what I really like to have even more so is what's called indemnity style. Okay, indemnity style. And all that means is the money goes to you. Remember those commercials, Aflac, Whack Whack the Duck, if you get sick or hurt and can't work? That's indemnity style. So in those types of benefits, many of them have 0 elimination period. Something happens to you today, you will receive dollars in the future as long as you qualify, right? It's not just like if you say, hey, I'm not feeling well. These are if you're having a major catastrophic event. You had a major accident, you're unable to work for at least 90 days. You can't do those activities of daily living. You can't feed yourself, dress yourself, bathe yourself, toilet yourself, transfer yourself from the bed to the chair. Or if you're diagnosed with a catastrophic illness such as cancer, heart attack, stroke, Lou Gehrig's, Alzheimer's, paralysis, if you were to have a transplant, if you were to go blind, those benefits will pay out. Now, how much does it pay? Because that's a question everybody always asks me after I say that. It depends on how big the bucket you could have. How big is your bucket? Most indemnity style plans, the maximum is $1.5 million. That's the most that I'm aware of right now in indemnity style living benefits is $1.5 million. So that is your bucket, $1.5 million. Whether you have it paid to you monthly, whether you have it paid to you annually, whether you take a lump sum. The thing about it that's beautiful is these are totally customizable programs. These are not cookie cutter, one size fits all. They're customized solutions really tailored to you, your family history. Maybe you have a family history of cancer. A lot of people tell me that's a big concern for them. Then we would customize that solution so that it addresses that. Maybe heart conditions run in your family. You know, maybe you know yourself and you're more accident prone. Some people just tend to be more accident prone. So we can customize this solution for you. So at the end of the day is how big of a bucket do you want? Do you want a big, robust bucket so that no matter what happens, you know, you have those dollars and you have it even into the future as you age? Or are you just looking to offset some copays and deductibles? It's really up to you, but that's a really great question. Does that help, Chris?
Yes, Miss Lee, I just wanted to know. I thought it was sort of like a 90 days. That's what I wanted to say, make sure, because most long-term policies do that. You know, and I just, you know, Sherry's got something she wants to say here, and then Martha was going to finish talking what she was saying. But before they do, I just want to say, I want to just advise everyone, please, if y'all not connected with Memphis, connect with her and get yourselves a policy, a long-term care policy to help. Don't wait till something drastic happens. Do it while your kids are young or while you're at a young age, as you said that earlier, Miss Leah. I just wanted to stress that and to get connected and get some kind of long-term care to help you because you never know what today or what tomorrow going to bring. You never know when you walk out that door or you get in that car and leave out the driveway. You never know what's going to happen because you could leave and something drastic happen and you don't have nothing set up. I really advise if I had when I was younger and had an opportunity to know about this, which I'm learning now because of you, Miss Leah. If I had known about this, I wouldn't be in the predicament that I am in now. And I'm just saying it's offered now. We're learning about it from you. So, and I'm just advising that everyone, please get connected and get a long-term care to help you with your kids, not even if it's your kids. It might be a parent, might be a grandparent, an aunt or uncle. Might help until mom or dad, your children will have something that would help them take care of mom and dad, or mom and dad will have something to take care of their children. And Sherry, what did you have so Martha can lean in?
Have a full circle kudos for Miss Leah. Miss Leah, I met you 3 years ago in Shayna DuPont's audio room. And I asked you a question. My daughter is now graduating from high school. At the time, she was starting high school. And I had asked you, what am I going to do about college? And way back when, I don't know if you remember this, but you had advised me not to do that. And boy, I'm so grateful because there's other avenues to pay for college. But when your loved one needs long-term care, and I've seen this with my mother who had dementia, my father, he had two pensions, one from the railroad and one from the military. And he used everything, and all he had to his name was Social Security. And so I just want to thank you for that. I love you, Leah, Martha, Chris.
Oh, I love you too. Yes. And yeah, I know that's a hard conversation for a lot of people, well-meaning families, well-meaning parents. We want to pay for kids' college, but there are other programs that they can get. And I think it really does serve them if they've got to maybe work their way to college. And student loans is, not a terrible thing as long as they understand, listen, they're going to have to pay those back. And there is no plan. There's no backup plan for retirement. There's no backup plan for long-term care. And those backup plans are not fun. It means downsizing. It means going without. It means changing your lifestyle, all kinds of different things. So I'm so glad that you did find value in that so much. And I think I'm handing it over to my corazón, Miss Margaret Martinez.
Thank you so much, Leah. This has been really wonderful. I just want to thank everyone. Brother
Can I
Chris.
share something before we go? I'm so sorry. Real quick. I'll be fast, I promise. I just wanted to attest with what Leah said about the HMO plans, to stay away from them, also called Advantage healthcare plans. I know that Medicaid is now really promoting these HMO plans, these Advantage plans for our seniors. So there's choices. You don't have to go that route. And then also for anyone that's needed an advocate, again, reach out to your health plans to see what's available within that health plan. They are providing services here in California. They're even helping people that are behind on rent or need deposits. So tap into those resources. And then there's also on a national level, there's support for seniors in different counties. Here in this county, it's called Alliance on Aging. And they provide services for seniors who may need food, transportation, legal advice. So just some support there. All right. Thank you so much. And I'll pass it over to you, Margaret. Thank you.
Okay, thank you. Can you guys hear me okay? I was just kind of wondering. Sorry.
No, you're perfect.
Okay.
Loud and clear. You're doing well.
Okay. It's one of those things that you can't hear on the other end. But thank you so much. I was just going to say really quick a thank you to Brother Chris for his story, for sharing this, and for making all of this possible, these conversations that are very important that, we see other events, but we never hear of the discussions that we're talking about here. So another great topic, Brother Chris, in sharing your story with everyone. And it's millions of stories that are just the same. So we're grateful to have you. Thank you. Thank you, Leah Garcia, for streaming this. And Martha, welcome. Welcome to the team, girl. And Cherry, my beautiful co-host, thank you for being here. I'm glad you got to hop on and speak and stuff. So, and thank you for being the great teacher that you are. Thank you so much. Appreciate you all. And everyone joining.
Yeah, this is incredible. Absolutely incredible. And Cherry Berry, I'm so glad you made it. And I honor you for your determination, because I don't know what was happening, but they were trying to keep you off. But what you dropped was some golden nuggets. I'm so glad you came back. And this was a lot of fun. I know that people got a lot of value. Please share this with your audience. Invite somebody, tag somebody in the comments who needs to hear this, whether they're a teen, right? Or even yourself. Do you have living benefits in some form or fashion? Do you have long-term care? Do you have your medical directives and HIPAA release and medical power of attorney and financial power of attorney? These are high-level conversations. We may need to make them commonplace, because we're all going to be impacted. Either we're going to live too long, die too soon, or get hurt. And if nothing's going to happen to us in that way, which I'm sure it will, but somebody we know and love and care about most is going to be impacted by this conversation. So I thank all of you, appreciate all of you. I love looking on this and seeing all your beautiful faces, because That brings back so many incredible memories. That's how I met all of you, is in our LinkedIn streets. And we're going to keep the party going. We're going to keep the conversation. We're here to be the advocates of your community, saving teen lives. Please connect with Chris. Please visit his YouTube channel. Please visit his website. Check out his merch. Get his book. Please support him in his crusade and his passion for bringing awareness to distracted teen driving. So thank you so much, everybody. We appreciate you so much. Enjoy the rest of your Wealthy Wednesday. Remember us. Think about us. We love you all. Thank you so much.
Thanks, Miss Leah, Martha, and Sherry.
Thank you.
And Margaret and Miss Martha. Thank y'all for putting this on tonight. Thank you for bringing it on to your restream, Miss Leah. I really appreciate that. And before you close out, I'd just like to say, let's start and put our teens first, and let's put family back together and let our teens know that parents, you do love them and you do care, and ask them what happened and let them collaborate and let their children ask you what happened at work. Let's start putting our children first and not our jobs. Thanks, Miss Leah, for putting this on your platform, and thank y'all all. And welcome, Margaret, to our Martha, to our new team, to our team with Miss Sherry and Margaret, and Leah's here. So welcome. I'm so excited and very honored and proud that you have joined us. Thank you, Miss Leah.
Beautiful. Love you, everyone.
I recommend we should have another event because this was very nice. Thank you. Thank you, everybody. Very much.
Connect with all of us. Connect with all of us. Thank you, Leah.
Thank you. Bye, everyone.
Bye,
Bye, everyone. Bye.